Hello, I'm Matthew Gavidia. Today in the MJ's Life Sciences Medical World News, the Center for Biosimilars is pleased to welcome Chad Pettit, Executive Director of Marketing and Global Biosimilars Commercial Lead for Amgen. Great to have you on. As our first question, there have been two biosimilars approved all year in 2020. Some feel this is a slow pace. Why is Amgen so upbeat about the rate of biosimilar reentry?
Yeah, that's a great question, Matthew, and thank you for taking time. Just as a little background, Amgen's been developing biologic medicine now for 40 years, and we understand innovative medicine. We've invested in biosimilars. We've got a portfolio now of 10 biosimilars that we're launching uh, with a total investment of about $2 billion. So we're very optimistic about the biosimilars marketplace and the direction it's going. If you look at this point in time, which I think is really where your question is getting to, it's really a time of remarkable change. Today we've got 18 FDA approved biosimilars on the market. There's more on the way. Last year was a really incredible year. We saw a 65% jump in the number of approved biosimilars and a 157% increase in the number of biosimilars that are available on the market. So when we look at this year, we really believe that the U.S. marketplace is really poised to welcome new biosimilars in 2020 and beyond for years to come, and that the competition that results from that will result in significant cost savings for the healthcare system.
Now, something you just alluded to, Amgen has biosimilars in the market, as well as originators that face competition. Would Amgen's report be less positive about the market structure if its reference products weren't holding up so well against competition?
The report was developed as part of Amgen's commitment to stay at the forefront of biosimilar education. And what it does is it reveals the mechanisms that support the long-term success and the sustainability of the marketplace with biosimilars. And and really, if you look at kind of the big picture of the story that comes out from this data, it's that the U.S. marketplace is really well established and accelerating across the key therapeutic areas, which then creates this cost savings and additional treatment options for physicians and patients. And so, like I said, with Amgen, we've been in biotechnology. We're a pioneer in biotechnology. We've been in biotechnology now for 40 years, and we have innovative medicine, which is critical to treating disease, major diseases across patients, and then we have biosimilars, which create competition that allows for cost savings. And so I think, if anything, Amgen's actually more credible because we look at the biologics marketplace in totality.
Can you explain how CMS's new HCPCS codes for biosimilars have supported improved uptake and better savings?
Yeah, it's a good question, and I think it's a bit of a technical question. I would say, and if you look at the report, actually, we highlight that assigning a unique HCPCS code for each biosimilar can help promote a robust and competitive marketplace, and it really does it in three ways. One is having unique or separate HCPCS codes creates a foundation for innovation by supporting a sustainable marketplace over the long term. And then secondly, it lowers, because it creates a sustainable marketplace, it lowers the risks that are associated with developing and marketing these complex products that are biosimilars. And so it allows biosimilar manufacturers like Amgen to invest with confidence in medicines that are going to compete in the medical benefit side of the U.S. business. And then the third thing it does is it creates a level playing field for both the reference products and the biosimilars. And one of the ways it does that is by reducing some of the concerns and confusion around traceability, which shared HCPCS codes would create.
When the Amgen report talks about overall market share for biosimilars, is that CMS and private payer coverage taken together?
Yeah, it looks at the totality of the market. Um, the reality is you have to look at the market um, at that level. Every product's going to be different in terms of the proportion of patients who are on Medicare, typically 65 and older, versus those who are receiving coverage through their employer very often through private coverage. And so there's going to be differences by product. What I could comment on in terms of market share, though, in totality, is that as if you look at the biosimilars that have launched, many of them have really gained significant share for the therapeutic area where they were introduced. And as an example, the short-acting granulocyte colony stimulating factors, or GCSFs, they've achieved more than 70% share in 5 years. And the long-acting GCSFs have achieved 20% share in just the first 12 months they were on the market. And then as another example that's important for Amgen, we just launched two oncology therapeutic biosimilars in the United States, and in the first year we've achieved nearly 40% share and then 30% respectively for these two products. And in doing so at list prices that are 15% lower than the reference product and an average selling price that's 12% lower than the average than the reference product, which creates savings then for both Medicare and commercial payers.
Some think that CMS has done better at incentivizing biosimilar use than private payers. Do you agree or disagree with this statement?
You know, I think the one thing that CMS has done that I think has been really important is it's laid a foundation for success with separate payment codes. And what that does is it allows the reference product and the biosimilar products to each compete on a level playing field. And because of that, when we look at competition, both in Medicare and with commercial payers, we're seeing really good success. Commercial payers have all the tools they need to support biosimilar competition and uptake, and Medicare has created this level playing field, and the results really speak for themselves. We know just with our experience, like I said, we've had our two oncology therapeutic biosimilars secure nearly 40% or 30% of the market share, respectively, in the first year, which is great. It's fantastic. And then if you look at other products across biosimilars, they're also achieving very strong uptake, which really is a reflection of competition. And if you look at the benefits of competition, as competition has grown, we've seen prices fall. And for example, there was a recent Bernstein analysis that suggested that biosimilars are driving a consistent drop in average sales price of between 10 to 15%. And if you look at products that have been on the market longer, so let's say up to 5 years, we're seeing a 40 to 50% decline in average sales price, and that's reflected in the trend report. And I think just really a good example of how the marketplace is not only working with biosimilar competition, but really taking off.
Many feel that biosimilars in the United States have been a failure because the payment systems, such as rebates for originator drugs and PBM deals, as they make it difficult for biosimilars to get a foothold. What's your take on this?
Well, I think the proof is in the pudding here, and if you look at the marketplace itself, we're seeing really robust marketplaces across many different sets of products. Um, and like I said, we're seeing an average sales price decline of 20 to 40% for products that have been on the market for 2 years, but 40 to 50% for products that have been on the market for more than 5 years. And if we look at just the bevacizumab marketplace in just the 1 year that we've had on the market, it's been a 10% decline in average sales price. This is really a good example of how the marketplace is receptive to biosimilars, and that stakeholder confidence, which includes payers as well as health systems and providers, is encouraging proper use.
And to build on what you just said, although we're seeing biosimilar prices declining, why aren't we seeing commensurate reductions in reference product prices? And can we expect to see similar reduction in reference prices?
Yeah, the trend report, if you look at the trend report, actually does a good job reflecting the decline in reference product prices. And just overall, what that means is when you see reference product prices coming down, you see biosimilars launching at lower prices and then competing on price. That's the mark of a healthy marketplace, a system that's working. And that's the foundation for a longer term sustainable marketplace with biosimilars that ensures future investment both for reference product manufacturers and for biosimilar manufacturers. And that's something that at Amgen, since we do both, is really important for us. We believe that's the way to achieve success in creating life-saving medicines and cost savings in the healthcare system.